and thank you for joining us and registering to hear more about our We're Undefeatable journey that we've called Moving Miracles in Rural Somerset. So my name is Leanne. I work for one of the 43 active partnerships in England known as Somerset Activity and Sports Partnership, or SASP. There are 3 of us presenting today. There's myself as the project lead for We're Undefeatable. I joined SASP and the local activation this time last year. Then we have our Deputy CEO, Jake Hannis, who joined SASP and We're Undefeatable back in January 2020 when it first launched. And Jake has supported the journey throughout. And then we've got our CEO, Jane Knowles, who secured the activation funding for us to bring We're Undefeatable to this rural county. We've each brought something a bit different to the process and the journey, and we felt it'd be really nice to reflect this as we talk through the various aspects of our activation today. So this morning we'll be looking at a bit about the context, so why West Somerset, a bit about the ambassador journey, the approach and how it's evolved and changed in response to the pandemic, the shielding list and the insight that it's brought for us, and then some of our achievements and our learning around some of the behaviour change, culture change and the products that we've used, as well as sort of recommendations on what's next for SASP and long-term conditions in Somerset. And I'm just going to hand over to my colleague Jake to get started.
Good morning, everyone. So West Somerset is the activation area for our We Are Undefeatable campaign. It's a large rural area of the county, although it's sparsely populated with just over 34,000 people living across 290 square miles. It's very rural and it has limited transport links. And just to give you some further context around West Somerset, is a third of the West Somerset population are 65 and over. The ageing population is growing extremely fast, with older people expected to make up 50% of the population in some areas by 2023. 2/3 of the population in West Somerset are living with at least one long-term health condition, with a significant number of these around the more elderly population. So our We Are Undefeatable campaign in West Somerset has seen us work with several partners. Some of these are shown on the screen with their logos. Many of these we were working with on We Are Undefeatable in West Somerset from our initial launch in January 2020. However, our activity pack work, which Leanne will talk about more later, certainly helped cement these partnerships, and other partners have approached us. New relationships have formed that might not have presented themselves before the pandemic. So I'll hand over back to Leanne.
Thank you, Jake. So now I'd like to share with you our ambassador video that we created to really capture the journey from the people's perspective, the challenges, the highlights, the conditions and the programmes as well that we've used to develop and support people at home and outside through We're Undefeatable. And I guess as we watch this 5-minute video, I encourage you to think about your own movement perhaps, and whether you might want to do a little bit of a chair march or a bit of stretching as you listen and watch. Enjoy.
Hello, I'm Sharon. I'm one of the ambassadors for We Are Undefeatable. I'm 60 years old, and 3 years ago I was diagnosed with fibromyalgia.
I've got quite a rare muscle wasting disease. It's called Charcot-Marie-Tooth.
I've suffered with quite debilitating osteoarthritis for a large number of years.
My initial problem is prostate cancer.
I attended the gym following a heart operation to put a new aortic valve in, and I needed to get moving again.
I was diagnosed with breast cancer several years ago, and before that I was very fit, very able. Unfortunately the chemo really affected my ability.
3 years ago I was diagnosed with lymphoma, cancer of the blood. Before I'd had my cancer, I used to always keep myself very active. Swimming, line dancing, walking group, you name it, I used to do it.
My health deteriorates through lockdown. My legs really got more aches and pains in.
I used to be a yoga teacher and I did physio for my profession. So for me to be not so active and suffering from a lot of pain in my legs, I have been finding really difficult to cope with.
I heard about referrals, and so I went to saw our practice nurse, said yes, go and see the doctor, and he referred me. Gyms are not my scene. And therefore when I came here, it was a revelation, because there are lots of people just like me.
Doesn't matter how ill you are or disabled, there are exercises to do.
I'm John.
And I'm Michael.
And we are two of the Undefeatable ambassadors.
COVID was such a big hit, especially to the vulnerable such as ourselves.
During COVID, it became all too easy for me to sit basically on the sofa and not do an awful lot.
It would have been just so easy just to give up.
My granddaughter saw the Active at Home pack, so I thought, right, this is something I can do. In the pack was instructions how to use a yellow resistance home band. I am an ambassador for We Are Undefeatable.
And then I heard about an amazing programme that's called Love to Pedal.
It was the doctor that suggested I try the pedals. I think they're brilliant. It just makes you feel like you're outdoors.
From the comfort of your home, you can go all over the place.
When I came out of my room, I see him pedalling, so I thought, yeah, I'll give it a try. And let's hope we can keep it going.
I think it's really important to highlight how motivating cycling is for people who have had a stroke.
And it's about empowering them to take control of their own therapy and to be in control of it and be responsible for it and continue moving forwards on their rehab journey. We'd really like to continue our working with SASP, and any other projects you have in the future we'd be really keen to be on board with.
And I got to a point where I thought I have got to get back to doing some exercise again. That's when I discovered the We Are Undefeatable Facebook group. It's changed everything. It is a very supportive group, and the exercises, the videos are so easy to do. Anybody can do them.
Towards the end of the second lockdown, I heard about the SASP project, Walk Your Way. It's great that I can do these walks on my own, knowing there's places to stop, to sit, they're fairly even. Sort of changed my life, really.
That journey you're making is leading somewhere which you're really going to benefit from.
Just do it, just get the pedals, because it does help to take your mind off the pain.
I just say do it. They are brilliant, and I would recommend them to everybody, whether you've got mobility issues or not, really.
Just don't give up. Keep going. That's all you can do. Keep yourself active.
Michael, you're a miracle.
So are you, John.
There's John and Michael there, and the inspiration behind our miracle theme today, What Stars. Feel free to post some reactions in the chat too. It's always lovely to hear people's thoughts and feelings in response to the video. Thank you. So now that we've seen some of our miracle makers in action, let's have a look at our ambassador programme a little more and see, you know, they've just been such a pivotal part of our activation in Somerset. So we know that healthcare professionals play a really important role in sharing messages around keeping well, but we also know that people with health conditions are just as well placed to talk about the benefits of being physically active, and we found this true within Somerset. So 10 ambassadors were originally recruited off the back of the campaign launch, and having sort of been really positively impacted by physical activity through programmes such as the exercise referral scheme that you just heard in the video, walking sports, walking the dog, or even just being with grandchildren. We spent time understanding their stories and sharing this with others, with some examples there in the blue for you. Our ambassadors were ideally placed to bring the national stories to a local level to help inspire others. They brought optimism and they instilled confidence through the various media, and we have some lovely stats there on the engagement on the right-hand side for people who do like some numbers. However, we know that the value in local conversations at local levels are really important, and the campaign enabled this to happen, with always that hook back to the national campaign at all times. Having something like this to back the messaging has been really important for us. Shortly after we went into national lockdown and shielding began, we were able to recruit the Chief Executive of the NHS Somerset Clinical Commissioning Group, the CCG, as one of our ambassadors, and someone who lives with long-term conditions and just really understands the message about physical activity. This relationship proved beneficial, and James has followed our journey, making sure movement has remained a really key focus and message in his role in the CCG, as well as in his personal life as well. There's no denying that lockdown was an incredibly challenging time. All of our ambassadors were required to shield, some with reduced or no access to digital technology, some living alone, and some found themselves pulling away from the campaign completely, just finding the situation just a little bit too much. For some, though, the restrictions reminded them of their need to remain determined to continue moving and sharing this in ways that were possible. This included writing blogs, recording videos from home about loneliness, talking to friends over the phone, and we used some of the footage gained along the way in one of our local conferences in Somerset and in meetings, which was a great way to bring some of the personal stories to life, whilst also reminding others of the benefits that keeping active at home could still bring. Since restrictions have eased, we have restarted our ambassador programme, and whilst we lost some along the way, we have recruited more, not just from West Somerset, but from all over Somerset, through wider SAS programmes such as Health Walk, social prescribing work, and through our We're Undefeatable programmes as well. Some are now even looking to expand their roles by volunteering with walk leading, with gym buddying, and helping to represent older adults in videos, at events and in meetings to have their say, which we feel is a really fantastic development and what we'll continue to build on. I'm just going to hand you over to Jane.
Thanks, Leanne. I love that video. Every time I see it, it just captures me. And those of you who managed to capture the captions of those people that those organisations that are there can see actually that we've really looked at, I want to say top, middle and operational. We don't mind that message just gets spread, and actually unlike coronavirus, which is perhaps a contagion we didn't want, is a contagious message, one of positivity, and it is that I think that has brought about so many miracles for us. So I get the job of talking about the approach and how we can make our miracles happen. So as an organisation, SASP is very embedded with public health, have been for a very long time. And so we had a great relationship. So when the opportunity came to be an activation area, we grabbed it with both hands. I'm going to say that at that point, our relationship with what was CCG then was pretty ropey, I think would be fair. I'm not sure that that is on a measurement scale, but I'd go ropey. We knew about them, they probably knew about us, but we didn't really do too much together. And there was £0 being invested into physical activity by our CCG. All the physical activity money was coming through public health. So it's a real tight time frame to get our bid in, and off we went. We had a neighbourhood group which was made up of lots of the great and the good, but I think that we all felt that actually they were still pushing responsibility back to us as an active partnership. Well, we really wanted to embed them in the work, and so it felt a little bit siloed, but we were really excited because we're like, well, we could make some really good things happen with a bit of investment, something that could really stand out. And that could really get people to understand the preventative nature and what it meant to people, not just their physical health, but who they were, their health and happiness, which is our focus. And I'm going to say Sport England, by investing in West Somerset, which, as Jake has said, is a hugely rural area, you know, it's got half of Exmoor in it, gave real gravitas to that. That they felt that a national partner was actually interested in their small area, made a real difference. And I'm a great advocate of a pincer movement. I'm happy to spout my stuff and be really quite rude sometimes and very inappropriate as national, with our great and our good, with, James Rimmer and all the rest in a relatively easygoing way. But actually, I also really love, you know, the Chrissies, the Johns, our ambassadors, who are just amazing too. And actually, I don't see a difference in value, difference in responsibility, but not a difference in value. And I really think that we need to keep that in mind. So our initial approach was exactly that pincer movement. We do training with our health professionals. We do lots of training and social marketing in our communities. But as the pandemic came, and as Leanne said, she's been with us a year. So I think Leanne arrived in the pandemic, and Jake arrived, I think, about a month before, maybe before lockdown. And into the pandemic we went with lockdown, and we needed to pivot fast. So we had our post holder, the one before Leanne, he was in post 3 weeks, couldn't furlough him. So we were like, oh, what do we do? So we decided we'd go for a very practical response. And those are the resistance bands that you saw in the video. And public health was completely tied up, obviously. So it was like, they asked us if we could represent them at some different operational meetings with CCG. And that was incredibly useful. It was our chance to create new relationships and for them to understand where we came from as an organisation and what was important to us. So as we moved into doing things, we really showed our partners what some sort of good old-fashioned partner work looks like. So we distributed resistance bands, we did great media coverage, and obviously radios, and we're looking for stories. And we just had some just lovely media interest, which generated a lot of individuals who came for the first time. Older people, I think it's fair to say, well, we'd done some work there. We'd never really had a following from older people. And we started to get that. And I suppose that created our energy, our positivity about doing the thing that we do. And so we get a lot of people who really want to just do what they call the strategic work. But sometimes you have to show people, I put Confucius there that we've all seen, about involve me and I understand. So actually involving people, getting people to understand the difference that very small amounts of delivery can make, created our strategic of tomorrow. And actually we are just, it's like night and day where we started and where we are now. And so I think that the getting embedded is where I want to be, because now as we get embedded, there's the show and tell, which we all like. Actually, now we share when we get others to tell, and that is very powerful. You know, we get others to tell in terms of our ambassadors. We get others to tell. You know, Jake started with a whole list of organisations that just come now to us because actually they're like, oh, we've got an issue. Would you like to come and help us? Come around the table and see what you can do about that. So that multi-agency piece, you know, our great relationship with public health meant that they asked us to go and represent them on the long-term condition cell, which led us to the mental health cell, which led us to community resilience cell. And it was such an opportunity, and I have to say we grasped it with both hands. And while we'd never have asked for a pandemic, obviously, this has been an opportunity to how we could all work differently. People's attitudes changed. People just wanted to get positive things done. So I think it's fair to say that physical activity, you know, can provide so much, and that messaging that came from Chris Whitty and Boris maybe on a national message every day almost really made physical activity stand out for our CCG. And those long-term condition cells were weekly. They, I think, lacked a little bit of leadership in places, you know, apart from dealing with long COVID. They seemed to not be quite sure what they were trying to achieve. So we were able to influence that and provide allyship to people who were already, you know, working, you know, huge numbers of hours. And our strong social marketing background and our strong sense of we've got ambassadors and these are what they are saying. really made such a difference. So I think it's we now, just as the creation of mini miracles for me was really around from maybe a year and 3/4 ago. CCG invested absolutely nothing into physical activity. They now invest over £200,000 a year in physical activity. And that is, I'm not sure that's a mini miracle. We've been waiting, public health have been trying to get that miracle happening for a long time. And actually, the We Are Undefeatable approach has been the way in which we've been able to make that change happen. Sorry, that's me. I'm handing on to Leanne. Oh, Jake, sorry.
Thanks, Jane. So I'm just going to cover off the shielded list and the insight work that came for that. And as Jane sort of said, is we were asked Jane was asked by Public Health to represent them on the long-term conditions cell, one of several cells set up to respond to COVID. The group was made up of representatives from Somerset CCG, Public Health, Somerset Foundation Trust, the County Council, and having seen Sheffield produce an active at home booklet and distribute it to the shielded population, and also having some initial success with our resistance bands and activity pack, Jane asked the question to the lead of the COVID response at the CCG if a mail out was possible. The CCG and the shielded cell agreed that they would distribute and fund a mail out, and so the miracle mail out began. And we say miracle mail out because there were times when, to be honest, we never thought it was going to happen, mainly due to working with the CCG, but also GDPR issues. We were not sending out the mail out. The logistics were really complex around the contents of a joint letter with the CCG, getting approval to the size of the envelopes used and the weight of the contents of the envelopes. So there were times that actually, you know, we thought that this is never going to really happen. But the shielded patient list is obviously a record of those vulnerable patients throughout or thought to be at high risk from complications of COVID. And in Somerset, there were just over 27,000 people on that list. So the mail out included a covering letter from SASP and the CCG, the Public Health booklet, Active at Home booklet, which was based on the Sheffield one that was talked about before in the introduction session this morning. We Are Undefeatable, the Moving More at Home booklet for under 60s, and then our physical activity survey, and also a free returns envelope. Now, the survey covered a range of different topics, so not exclusively physical activity, providing both a quantitative and qualitative data. The survey incorporated elements of the weekly Sport England COVID-19 survey, as well as some of the We Are Undefeatable tracking research to allow for some comparisons at a national level. So things like demographics, health, digital access and confidence, physical activity, barriers and motivations, and whether they had any knowledge of the We Are Undefeatable campaign, and most importantly, follow-up contact details. Now, we received over 2,800 responses, so over a 10% response rate for a postal mail out of this kind was really encouraging. And I guess this for us was the gold dust that we've been waiting for, because all the replies came back direct to us, and we were the ones who formulated in partnership with Exeter University the research around this and the results. But as well as the survey responses, we also received letters and phone calls which really highlighted the lonely people and the isolation of these people that are on a part of the shielded population. And I just want to share with you one of the letters that we received. And I have sort of edited it a little bit, but I'm just going to read it out now. So, dearly beloved, I've just discovered what's in that little booklet that accompanied your questionnaire. On which note, please forgive my handwriting. The old arthritis is playing up today and my hands are not doing as they're told again. However, I have embarked on the exercises. 55 years ago or thereabouts, I yonked up a Welsh mountain with a 25-pound man pack and rifle and 6 mortar rounds and was completely knackered at the end of it. But so was everyone else in the platoon, so I didn't feel so bad. Now, just meandering through this booklet, the Mein Kampf of my new regime, I'm not as worn out as then, but by heck, I know I've done something different. I shall work out twice a week at first. The leggy bits are the worst for me. That's having 2 metal knees and being somewhat overweight. Thank you. I have a horrible suspicion this is going to make a difference. Still, in the months to come, I might well be able to manage to get down the hill to the pub and, more importantly, back up again. Mind you, the cider always helps, as indeed you have. And I think that just goes to show that letter, and we had a number of those types of letters, but it really shows the spirit and the determination of people who are dealing with long-term health conditions. The key findings and full insight, which were produced by Exeter University from the Shielded Patient List physical activity survey, is available on our website. And that link on the presentation will take you direct to that research. So we have got a whole webinar that we did on the research. And so I'm only going to cover the key highlights today. But essentially, 27% of the respondents lived alone. Social isolation is a key factor contributing to health and well-being. More than half of the respondents reported having 2 or more long-term health conditions. So not really any different to the national statistics around this. Digital access is high at 84%. And I guess that was the one thing that surprised us the most. But I guess I think it was 1 in 3 have low or no confidence in digital. So whilst lots of people had access to digital devices, there was really not much confidence in being able to use them. Living alone and digital inequality were both associated with numerous other negative outcomes. So if you lived alone and you couldn't use a digital device, you were less likely to, or you'd be less likely to be more physically active. There was no difference in physical activity levels across gender or age. And walking, as I think was touched on in the introduction this morning in the first session, was the most popular physical activity by far at 79%. So using the 1,800 contact details which respondents shared with us and consented for us to contact them, we followed up the physical activity survey with a focus group with a small number of respondents who've been fundamental to the co-design of our programs. The insight that we've gained from the Shielded Population Survey has given us a much greater understanding of people living with long-term health conditions within Somerset. So miracles do come in moments. We were definitely ready and we were definitely willing. So I'll hand back over to Leanne.
Oh, you're handing to me, but that's all right, because we're all handing to Leanne. As you can tell, Leanne's the anchor here. So I'm going to go quickly because I think we could be running out of time. So just some learning. And, you know, as we've said, sometimes a miracle arrives as a small shift and not small scale changes. And actually, we do this by increments. So our long-term relationships, I put a springs in because we're bouncy and flexible and trusted. And I can't tell you how important it is to live the positivity that being physically active is for people, because actually during this time our health services are under such duress, and still under huge duress, both in primary and secondary care and still in public health. And so actually just getting on and doing and making sure people know what it is that we're doing is really important. That ability to co-create, you've heard the voices come through and that lovely letter. We had a hotline and a number of people on the calls and letters, sad stories, but doing hearts and minds. Some people are really swayed by the numbers, some people are really swayed by the hearts, but actually bringing them together brings rich and deep stories and learning and deep resonance for people about what it is that we need to change and how we might choose to go about doing that. And I'm going to, that ability to stand strong on values and ethics. We have never, ever chased money. The money that has come because people have wanted to invest in physical activity and wanted to make a difference to those people that we have talked about. They want to be part of a solution and part of something positive. So I suppose it's one of my key things is, and before we started this presentation, someone said, oh, but this is so personal to you. And boy, yes, it's wildly personal to all three of us here and the rest of the team that sit behind it, hugely personal that we try and get this right. And that ability to turn a message into practical action. Messages are great, but what we found out is that lots of people don't know what to do to get themselves active or lack that confidence to do so. And the ability to work fast and keep going under pressure. So I'm going to say we locked down on whatever it was, 17th of March. We had active at home packs with the resistance bands going out at the beginning of April. It's just to keep going. So, and I think that the trick is really to keep those conversations going and make sure that people know what's happening. So some of our achievements. So we have a strong and growing relationship with our CCG and Foundation Trusts. So in Somerset, the Foundation Trusts, which are our hospitals, are actually very, very strong, quite powerful organisations. And we are finding our way through that. And Leanne is doing some amazing work in those places to really embed community physical activity rather than clinical physio staff. And that's working really well. The ICS, as we change, ICS is a tricky place. There's lots of change, lots of jockeying for position. But actually, we already have key relationships with people who provide key places in the ICS and already have a joint project with the ICS that we're working towards. And that major investment through the it's not COVID, it's Contain Outbreak Management Fund funding streams. You know, we have had over 180k and probably more invested in physical activity in Somerset of the million that Somerset had, which is, and we have more that we think will be invested as we go. So it's just such a huge change from what we've seen. And we took the opportunity, because we're terribly opportunistic, to actually have a system-wide physical activity strategy while everybody was so enthusiastic. And we're now in its final consultation phase with CCG, Public Health, County Council and Education all signed up to that. And what's measured is what gets done in statutory authority. So it's felt to be really important. Working at scale, we've talked a little bit about that, but we can manage big numbers, and I think we've proven that, and we can prove that we can reach big numbers, and that's been important. And then embedded as that key infrastructure partner, we are now invited as most active partnerships to huge numbers of physical activity or to represent physical activity at huge numbers of meetings, just because we've become a key and trusted partner who believe that actually we're not just going there to snaffle money. What we're going to do is to try and make people's lives better. So I'm handing definitely back to Leanne this time.
Thank you, Jane. So the other half to our learning and our achievements is definitely around the miracle products that have helped us to initiate, to grow and develop some of these positive relationships with the health system, the voluntary and community sector, as well as individuals at home. So back when the pandemic hit, we went into national lockdown, and we've heard about how the Active at Home packs was one of our very quick sort of turnaround products, really, that we felt was so important to help people at home. So 2,000 Active at Home packs were pulled together by hand at SASP, no mean feat, and included in an introductory letter, resistance band, exercise booklet, and some of the We Are Undefeatable promotional material. I think the main challenge with the distribution of the packs was reaching the people, though, with many services paused, travel restricted, no one really leaving home. So partnership working was absolutely essential to make this happen and for us to reach a much larger and wider distribution. So we partnered with the primary care network, with local authorities, housing associations, healthcare teams and charities, those we'd already struck a really good relationship with off the back of the launch. But after a short while, other organisations heard about the Active at Home packs and approached us to get involved, and it was a really positive step for the campaign work locally. With the speed of us developing and distributing the packs, there was little time to probably properly consider the evaluation of their success, but feedback did come in the form of those lovely letters that you've already heard about, emails and answer machine messages. It was really generally very positive. So Walk Your Way is a product of our Miracle Insight. It was a co-design from the Shielded List Survey follow-up Zoom workshop that Jake's already alluded to. And it was really a case of pulling people together that had shared their insight from the survey and wanted to understand some of the results that we'd gained. It was clear from the feedback that walking was the most preferred physical activity, but walking groups and the maps already available just didn't seem to fit the bill. So pace, frequent stopping points, unpredictable symptoms, flare-ups day to day, the terrain, toilets, parking, all of these things were really big obstacles for people when choosing whether to walk or not. So these became the key features and the essential criteria for Walk Your Way. So people can walk at home with chair marching whilst watching filmed versions of the walks that are also mapped and available for people to complete outside as well. All Shielded survey respondents who wished to remain in contact with us after the survey were posted a copy of the mapped booklet and encouraged to give them a try. The feedback has been really positive, and we hope to expand this offer by creating some DVDs for those who cannot or prefer not to leave home this winter. So Love to Pedal is, as you saw in the video, a very popular and versatile programme that evolved after the concept of chair pedalling was shared by Active Wigan. So Love to Pedal takes chair-based cycling to the next level using filmed bike rides of Somerset to bring it to life at home. It can be used at home, it can be used in residential settings, in community groups and in healthcare as well. And Love to Pedal was initially rolled out across 54 care homes and extra care settings in Somerset, supported by the CCG and local housing providers. And now it's reaching people at home through social prescribing networks and village agents, for example. Hopefully the success of the programme was really evident in the video. It's definitely our most popular product, with physiotherapy, stroke, integrated rehab, brain injury charities, social prescribing teams, and more by the day at the moment, all wanting some pedals, which is fantastic. SASP Take Time is a library of exercise videos filmed by our qualified instructors who during lockdown began creating content and sharing this on our website. We have content around balance, stability, mobility, strength, cardiovascular fitness, and they all encourage people to get involved either in a sitting or standing position, depending on how their conditions affect them or how they're feeling. And the videos range from just a couple of minutes while the kettle boils to sort of just under an hour, depending on what people want to do. The We're Undefeatable Facebook group was set up not long into the campaign launch and acts as a nice place for people to come together virtually to learn about what's happening locally, share their experiences and tips, and is a really useful way for us to gauge feedback on some of our programmes as well. The membership of the group continues to grow, and we are seeing not just individuals, but professionals and community organisations joining this. And it's just another way of us highlighting lots of the work we're doing around long-term conditions in Somerset. So recommendations and what's next. So we've identified a number of key recommendations in response to the national campaign and the local activation. So firstly, identifying shared goals is key to relationship building and embedding programmes in communities. Local ambassadors are the experts by experience. They bring relatable stories, local conversations, trust and confidence. Involving the target audience is really useful for developing ideas, gaining insight and feedback. and identifying gaps in training needs around, having more positive physical activity conversations with people living with long-term health conditions is really important. And SAS, we've developed our own training programme to support social care, housing and the wider community sector, and we really look to expand that over the next 12 months in Somerset. Campaign messaging, so reaching out directly to the audience is one method, but not the only way to amplify a message. We recommend considering targeting children and grandchildren who can act as really useful conduits in communication channels. And just for reference, around 75% of the direct requests for the Active at Home packs actually came via children or grandchildren who'd seen the social media posts about it. Active partnerships. So hopefully we've shown how useful it can be using active partnerships like SAS to coordinate, to oversee and to provide gateways to physical activity in communities. And we also want you to challenge assumptions, so around long-term conditions in older adults, because not all communities are the same. And digital, for example, was expected to be a limited factor for us in Somerset, but in fact access was high, as Jake mentioned, and it was actually the confidence that was really low. The number of health conditions people have versus their activity level is really worth considering when developing programmes. So we found that moving from one health condition to two is where a large percentage of activity drops off in Somerset. So this is where the greatest impact could be found from some of our interventions. Having an adaptable approach can open doorways to new partnerships, and it can help to ensure conversations and programmes are relevant and filling gaps in the best ways. And lastly, I think involving healthcare professionals in interventions has massively widened the reach. It's highlighted other opportunities, built all important trust and confidence in community physical activity provision. And I guess linked to this, we're now seeing miracles happening within the healthcare system and them approaching us as the people in the know about physical activity. And this has led to work with perioperative care and surgery waiting lists, which is ongoing. Interest from pulmonary rehab, from Parkinson's, from prehab cancer services, post-COVID recovery clinics are all starting to come to us at SAS to seek guidance around how to build physical activity into clinical pathways and beyond that, with of course sort of the self-management conversation being such a vital part of that. So just to finish, I think we're naturally very excited about the miracle shift that we are seeing in rural Somerset. I think I speak for Jane, Jake and myself here in saying that we felt very proud of the work that we've achieved so far, using We Are Undefeatable as such a useful starting point in getting conversations going, gaining insight and developing new products. And we're very much looking forward to seeing how future miracles evolve as this continues, and SAS remains committed to the long-term conditions agenda in Somerset. Thank you.
Thank you very much, Leanne, Jane and Jake, for a really engaging presentation. There's been a little bit of chat coming through, and I think that quite a few people have been touched by the video and the letter that you shared. That was really lovely. Kirsty actually responded to one of the comments to share a link to the video within the chat. So hopefully if attendees want to access that, they'll now be able to. We don't have lots of time for questions, but I thought I would just put one to you guys, if that's all right. And that's just to ask, what would you say is the thing that you're most proud of? It's been quite wide-ranging work that you've done there in Somerset. What would you highlight as sort of the biggest thing you're proud of?
I think what we're most proud of in Somerset is how we've used each of our strengths here at We Are Undefeatable as a team at SAS. In order to sort of connect the dots between sort of the different levels of the conversations that we've been having. So talking at the highest level with the CCG and Jane's wonderful influence and her ability to kind of keep the physical activity agenda alive, sort of challenging where needed, and thinking sort of creatively about physical activity solutions to wider issues. And then sort of Jake and myself sort of connecting at the middle management level, and sort of being able to explore ideas together around some of the sort of operational aspects, the sort of new services, new programs, new provision. And then I guess myself working at more of an operation at the bottom level in the sense that I've got some good contacts in the NHS from previous employment, and being able to, I guess, on the side of that is sort of reaching people in communities as well across wider SASP work and other interventions that are happening with our teams. So it's kind of connecting all the dots together. It's probably what we're most proud of, because I think that's ultimately affected what we've been able to do and been able to influence across Somerset through We're Undefeatable on our journey so far.
Thank you. Yeah, really interesting. I suppose it's about playing to your strengths, isn't it? And that's often where we can have the most impact. Well, thank you so much again. And sorry we haven't been able to get to any more questions, but if you're an attendee and you've got a burning question that you'd really like me to follow up on, I can do that for you. You're very welcome to email me, barbara@insightangels.com, and I'll direct those questions in the right way. But for now, I just want to say thanks massively to Leanne, Jane and Jake for taking us through that. It's been really valuable, I think. And to everybody else who's still here, if you'd like to join up for other sessions and you haven't already, formal registration is closed, but you can still access meeting links if you check the link in the email to this the invitation for this session. You can actually access all the other meeting links via that. But any problems, just feel free to contact me. But we'll close there for now. Thank you everyone very much.